everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia the Pharmacist. If you're new to this channel, a warm welcome to you. This is a channel where we educate ourselves on common health problems. We talk about the causes of these problems, things that you can do to prevent these problems. We also talk about natural ways of treating these problems, as well as medications that you can purchase from your local pharmacy when these conditions occur. So please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. And to all our returning subscribers, thank you so much for all the support. I really appreciate you. Today, I'm going to be talking about a very interesting topic, and I hope you stay with me till the end so you can learn something new. We are going to be talking about nosebleeds or a bleeding nose. So one may ask, what is a nosebleed? A nosebleed is bleeding from the blood vessels in the nose. The lining of the nose contains many tiny blood vessels, and these lie close to the surface. And because of that, they are easily irritated. Two most common causes of a nosebleed are drying or cracking of the nasal membranes from dry climate and also trauma from nose picking. Other factors that increase the likelihood of a nosebleed include an infection, allergic or non-allergic rhinitis, hypertension, alcohol abuse, inherited bleeding problems such as hemophilia, a blood thinning medication, which are also known as anticoagulants such as warfarin and heparin, also chemical irritants such as ammonia. A foreign body in your nose can also cause a nosebleed, and nasal sprays that are used to treat allergies, when used frequently, can cause a nosebleed. A common cold can also cause a nosebleed, and cocaine use is also a cause of nosebleed. The main symptom of a nosebleed is bleeding in the nose. Usually, bleeding occurs only in one nostril, but when the condition is serious, then you can get bleeding from both nostrils at the same time. Sometimes blood can go down back into the throat and into the stomach, and this can make the patient spit up or vomit blood. If there is a lot of blood loss, then you can experience symptoms such as dizziness, weakness, confusion, and fainting. And if blood accumulates in the throat and is swallowed, it may cause nausea, vomiting, or diarrhea. So now, our main focus, what can you do when someone experiences a nosebleed? I'll talk you through some self-help tips that you can apply in less serious cases. So step number 1, if someone is having a nosebleed, ask them to sit down and lean with their head tilted forward. Keep the head higher than the level of the heart. Do not tell them to lean their head back, as this could cause the blood to trickle down the back of their throat and block the airway. Step number 2, ask them to breathe through their mouth and pinch the soft part of their nose between your thumb and the index finger and press towards the face. Give them a clean tissue to catch any blood. Step number 3, after 10 minutes, they can release the pressure on their nose. Ask them to pinch their nose again if the bleeding has not stopped. They should do this for 2 further periods of 10 minutes. Step number 4, once the bleeding has stopped, ask them to keep leaning forward whilst you clean around their nose with lukewarm water. Once clean, advise them to rest, avoid exertion, or avoid blowing their nose to prevent disturbing the blood clots that have been formed. If the bleeding is severe, or if it lasts more than 30 minutes, then call the emergency medical services. If you live in the UK, the number is 999. If these measures do not help or the bleeding is severe, a doctor may use heat or chemical application to stop the bleeding. In some cases, packing may be placed inside the nose. So when do you have to see a doctor if your nose is bleeding? If the nose bleeding is occurring in a child below 2 years, then you would have to visit a doctor. When the nosebleed comes and go regularly, then you would have to see a doctor. And you would have to see a doctor immediately or go to the accident and emergency department if you notice bleeding for longer than 20 minutes. And when the bleeding is heavy and there's a lot of blood loss, when you're experiencing difficulty in breathing and large amounts of blood have been swallowed, leading to vomiting, when the nosebleed is caused by a car crash, and when the person is on a blood thinning medication, this has got to be attended to immediately. An example of such medication is warfarin. Also, if you have a blood clotting disorder such as hemophilia, then you would have to see a doctor immediately or visit your accident and emergency department. There are times also when the bleeding does not stop, and this calls for an emergency help. I hope you have learned something new today. Please give this video a thumbs up, share with your family and friends, and if you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell. Don't forget to leave your comments and your questions in the comment section. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.